So now we want to look at the openings that we can see on the inferior view of the skull. And unfortunately, the holes in the bones, the openings, are the most challenging part of skull anatomy. For the most part, if we learn the openings based on what bones they're in or between, that will help a lot. I have a worksheet that I'll also post on Moodle, and I'll have a explanation video of that worksheet as well. So let's start on the openings from the inferior view. We'll start anterior and work our way posterior. So the first opening that we see is in the maxilla. So here's the anterior portion. This opening is known as the incisive foramen. So here's your incisors. The incisive foramen is near it, in anatomical position just posterior to it. Working our way back through the skull, inside the palatine bone, you'll also see an opening. These are your greater palatine foramen. I'm going to tip the skull forward a little bit so you can see them a little clearer. So the greater palatine foramen. And there are also some smaller holes, but we're not going to worry about those. In our sphenoid bone, there are two openings that we are going to see from both internal and inferior perspectives of the skull. And when I describe these to students, I always say they're like Batman and Robin. They're always together. These are, from the inferior view, the only two holes that you're going to see in the sphenoid bone. It's a part of the sphenoid bone. These are your foramen ovale. So if you look at it, it's literally shaped like an oval hole. And hanging off the posterior and lateral end of it is a very small hole called the foramen spinosum. So foramen ovale and foramen spinosum, they're always together like Batman and Robin. And you can see them again on the right side. So foramen ovale, foramen spinosum. Another thing you notice as you work your way through the skull is that there are several junctional holes. Those are ones that are between bones. So between our occipital bone, our sphenoid bone, and our temporal bone, we have a big irregular opening called the foramen lacerum. And usually when I tell this to students who are new to anatomy, I tell them to pronounce it the foramen lacerum because it laces all three of these bones together. So foramen ovale, foramen spinosum are in the sphenoid bone. The foramen lacerum is between sphenoid, occipital, and temporal on the left and right. As we work our way posteriorly, inside of the temporal bone, we have two holes that we are going to take note of. The easiest one of the two is a tiny hole that we're only going to see on the posterior perspective here. And it is between the styloid process and the mastoid process of the temporal bone. So this tiny little opening here is known as the stylomastoid foramen. So stylomastoid foramen. The last hole is probably the most confused one whenever I teach this. This one on the inferior perspective is pretty easy because it is perfectly round. It's known as the carotid canal, and it is literally canal. It tunnels through the bone, through the temporal bone, which is really hard and really thick, and we're going to see that on the internal perspective. So it will be in a completely different position when we flip the skull over. So this is your carotid canal. Again, pretty nice and round on both sides. Working our way posteriorly, there are three openings associated, two openings associated with the occipital bone only, and one that is junctional. So I may have to change perspective a little bit for you to be able to see this opening. So between our temporal bone and occipital bone, we have a really weird, irregular junctional hole called the jugular foramen. And this one, jugular, it kind of looks like a jelly bean if you look at the shape of it. It's pretty large. And again, it's on the left and the right as well. So jugular foramen. I'm going to set this back down so you can get some perspective from a flat view where this would be. So jugular foramen, and just anterior to it, that's where your carotid canals will be. And these are important holes. Carotid canal is where your internal carotid artery will go through and pass to take blood to your brain. The jugular foramen is where your internal jugular will bring venous blood drainage out of your brain. So very important openings. In the occipital bone, there are two openings that we're going to worry about. The biggest one is the easiest, the foramen magnum. The name translates literally to big hole. So that's where your spinal cord passes through. The last opening is the hypoglossal canal, and so you have a little nerve called the hypoglossal nerve that comes off of the brain and goes to the back of our tongue. So hypo underneath, glosso is referring to tongue. So if we find our occipital condyles, which we looked at before, so these smooth rounded surfaces here near the foramen magnum, and from this perspective, if we look just underneath them, you'll see fairly large openings. These are the hypoglossal canals. So you can see how this nerve would come off of the spinal cord and go to the back of the tongue from this perspective if you look at the wire. And those are our openings from the inferior view.